Hi, welcome to another episode on Mednage with Dr. B. Now, we are going to be treating the part 2 of the musculoskeletal assessment on the upper limb. So, in the past video, part 1, we did the examination of the shoulder joint. But here today, we're going to be doing the elbow joint and the hand joint. So, from the wrist to the hand joint and Carpal Tunnel Syndrome maneuvers, two special tests you do. Okay, come with me. Starting with the inspection of the elbow joint. So we're going to be looking at the 5 signs of inflammation, the 5 cardinal signs. So we're checking for any form of redness, swelling. 1. Loss of function. Now, we're also going to check for pain. If my patient was in pain, she'll scream. Now, we're going to be looking at based on skin and soft tissue, muscle and bone. So skin and soft tissue, we're checking things. No sign of ecchymosis, petechiae, purpura, no sign of plaques, vesicles. We can't see any sign of swelling of the olecranon bursa area, signified bursitis. Now, I'm gonna go to muscle, no sign of atrophy, fasciculations. Now, during that period, we also look at no sign of the palpation sign. So that's the sign of the bicep tendon rupture. Now, we're also going to look at the alignment of the bone. No sign of dislocation, subluxation, and fracture. So, this also, you also check for the carrying angle abnormalities, the deformities like the cubitus valgus and cubitus varus. So, no sign of that. Then, okay, now I'll be moving on to palpation. On palpation, we're going to be specific to checking for the olecranon process. Now, we're going to palpate it. Now, you're looking for any form of displacement. Now, you're also going to be checking for your medial and lateral epicondyle. You're looking for any form of tenderness. If there was tenderness there, my patient would have screamed in pain. Then also, there is one amazing structure just between the olecranon process and the medial epicondyle. Now, that structure, which can easily be palpated, is the ulnar nerve. It can be palpated. Okay, now, lastly, we do the range of motions. Now, for the elbow joint, we have 4 range of motions to do. So we'll flex, so this flexion, extension, pronation, and supination. With that, we're done with the elbow joint. So now we're going to be looking at the wrist and hand joint with carpal tunnel syndrome maneuvers. Special test to do for that. Okay, so let's start with the inspection. Now, similar to the elbow joint, you inspect based on the 5 cardinal signs of inflammation, which we already know. Then we also inspect for skin and soft tissue, muscle and bones. So you're inspecting no signs of swelling, redness, warmth, no sign of loss of function, pain. Now, you're also checking for no sign of ecchymosis, petechiae, purpura, pustules, patches, plaques, vesicles. You're also checking to see if there is any form of bugginess. Now, you're also looking out for muscle. So we're checking both the tena and apotena permanence. We're checking for any atrophy of muscle. We're also checking for wasting of muscles of the intrinsic muscles of the hand. So basically to rule out claw hand. Now, we'll also be checking for bone. So any sign of bone enlargement, for example, in your metacarpophalangeal joints, which will signify the rheumatoid arthritis, arthropathy. Now, we also check for ebony nodes and bulkhead nodes. The ebony nodes are found in the DIP and the bulkhead nodes are found where? In the PIP. So, all these rule out. We're also going to be checking for swan neck, which also signifies rheumatoid arthritis. By the way, the everything and the butchered nose, they signify osteoarthritis. All right. So the next step is to go to palpation. So what do we do on palpation? We start step by step. You're going to be palpating. So on lateral side, the distal radial. On the medial side, the distal ulnar bone. You're coming in and you're palpating your 8 carpal bones. You're moving on to palpating your metacarpal bones, and as you're palpating that, you come over here and you're also palpating the joint of your MCP, metacarpal phalangeal joint. Don't forget you're doing both on your right and your left. Now you also come, now you're palpating both your PIP and DIP joints. Now, while you are doing this palpation, you're checking for swelling, bugginess, any form of bone enlargement. Now, after palpation, we go to our first step on range of motion. So we'll start with the wrist joint. Focus there. Now, initially on the elbow joint, I was the one doing the action for the patient, so that's called a passive action. Now I'm going to tell my patient to do whatever I do, which will be the active. So patient is initiating the action herself. So first of all, we're going to look at the flexion of the wrist joint. So your palms down and do this. Good. Then extension, your palms up. Then the next thing is radial deviation. Make sure your palms are down like this. The radial deviation is also called the abduction. So you go in, thank you, and then ulnar deviation, which is also called the abduction, and you go out. Thank you. And with that, we're done with the wrist. Now we go to the hand joint. So the first thing you do is flex your hand. You see it? Extend. Good. Abduction. Abduction. Then for your thumb, we have a special one for the thumb. You do your thumb, you do your flexion, extension, then abduction, adduction. Then the last one, which is opposition. Thank you. Now we're going to be looking at the Carpal Tunnel Syndrome special maneuvers. We have 3 of them, and the first one is the thumb abduction resistance test. So my patient is going to be abducting her thumb while I'll be doing the opposite action, which is adducting it. If she's able to resist my thumb, it signifies, without any form of restriction, it signifies no form of damage to the median and then by compression, which occurs with Carpal Tunnel Syndrome. Okay, so let's go. So you do something like this. Good. And she's able to resist it. So yeah. Then the second one is the Tinel sign. Now the Tinel sign, all you do is go to the medial nerve distribution where it passes through and you just tap. Now with that tap, if my patient has Carpal Tunnel Syndrome, oh God, she's in severe pain. The last one is the Phalen. I'll tell my patient to do this. Now, with that test, also, if my patient has any form of Carpal Tunnel Syndrome going on, she's in severe pain. And with that, we're done for this episode. Thanks for watching. Please don't forget to subscribe, don't forget to like, don't forget to share, comment, and in case of any questions, please bring in your questions. We're always willing to answer you. Thank you for your engagement on MedNeed with Dr. B, and see you next episode. Bye. Redness, warmth. So basically, then we check. Oh my God! Look, I'm not breaking. Sorry.